You are now inside the patient's heart. To help this patient, you need to find her tumor and eliminate it. Remember that she has been suffering from severe abdominal pain for several weeks.
Very well done! The patient is doing better since you removed the lymphoma from her abdomen. Lymphoid tissue cancer is called lymphoma. This is a diverse group of cancers whose prognosis varies widely. Most typically, patients present one or more painless enlarged lymph nodes along with symptoms of chronic illness, such as protracted weight loss. Because lymph nodes are present throughout the body, lymphoma can involve nearly any organ. In this case, the major site of involvement was the left upper quadrant of the abdomen and the spleen. Lymphomatous masses are sometimes removed when symptoms justify surgical intervention. More typically, however, treatment depends on either radiation therapy, chemotherapy, or both.
You have been transported into the patient's heart. To cure this patient, you need to find her tumor and eliminate it. Remember that she's been suffering from progressive loss of hearing and ringing in her right ear.
Awesome work, Doctor! You have successfully removed the patient's brain tumor. This patient had an acoustic neuroma, a benign brain tumor that arises from the Schwann cells that surround the 8th cranial nerve. The 8th cranial nerve is responsible for hearing and balance, which explains why the patient had symptoms of hearing loss and ringing, tinnitus, in her ear. Acoustic neuromas account for about 5% of all primary brain tumors, i.e. tumors that start in the brain rather than metastasizing from somewhere else. As they grow, acoustic neuromas can cause deafness as well as other symptoms, facial pain, double vision, facial weakness. By compressing first the 8th cranial nerve and then the 5th, 6th, and 7th cranial nerves. Treatment depends on surgical excision. The prognosis is generally good.
You have been transported into the patient's heart. To cure this patient, you need to open up a blocked vein. Remember that she has been complaining of shortness of breath and pain in her right leg for several days.
Excellent! You have cured the patient of a pulmonary embolism. Pulmonary emboli typically occur when blood clots form within the large veins of the legs and then break loose. These blood clots then travel through the right side of the heart before lodging in the pulmonary veins. Once lodged in a pulmonary vein, a blood clot cuts off the supply of blood to a wedge-shaped segment of the lung served by that pulmonary vein. The affected lung segment rarely dies, however, because it also receives oxygenated blood from the bronchial arterial system. Nonetheless, pulmonary embolism is a serious illness that usually causes shortness of breath and chest pain. Diagnosis is most often made on the basis of the ventilation perfusion scan, which shows the segment or segments that are not receiving blood because they are blocked. Treatment is dependent on blood thinners which prevent new clots from forming while allowing the body's natural mechanisms to dissolve the existing clot. The main risk factors for the development of pulmonary emboli are a history of inactivity, such as that caused by recovery from an operation, and a previous history of pulmonary emboli.
You are now inside the patient's heart. To help this patient, you need to go exploring and open up a blocked artery. Remember that he is suffering from sudden paralysis of the left side of his body. Move quickly. Every second makes a difference.
Amazing job! The patient will recover from his stroke thanks to you. A stroke occurs when the blood supply to part of the brain is interrupted for long enough to cause damage to the brain. Blockage of the arteries supplying the brain is the most common cause of stroke. Emboli often form at sites of cholesterol plaque buildup within the carotid or neck arteries. The emboli can then break off and travel upwards to the brain, thus causing a stroke, infarct. A head CT is usually performed to make sure that the patient's symptoms are indeed attributable to a stroke and not to some other cause such as a brain tumor. The location of the infarct can be reasoned from the symptoms that the patient describes. The nerve fibers that control motor function and sensation cross over to the opposite side of the body. In this case, it is clear that the stroke must be on the right side of the brain, since the patient complained of weakness and numbness only on the left side of his body. Most likely, the stroke will turn out to be in the right internal capsule, a place in the brain where the nerve fibers for both the left upper and left lower extremities are close enough to each other to be affected together. Recovery from strokes is quite variable. Sometimes much of the initial dysfunction is due to swelling within the brain, rather than cell death, and in such cases, recovery of brain function is nearly complete.
You have been transported to the patient's heart. To cure this patient, you need to find all 10 of the bacteria and eliminate them. Remember that he has had a high fever, a stiff neck, and severe headaches for the last 12 hours. Avoid zapping healthy cells. Hurry, time is of the essence.
You zapped a nerve cell! Oh no!
Great job, Doctor. You have cured the patient of bacterial meningitis. Meningitis is caused by inflammation of the membranes, meninges, which surround the brain and spinal cord. Many organisms can cause meningitis, including bacteria, viruses, and fungi. These organisms usually reach the meninges through the bloodstream, after first starting the infection somewhere else in the body. Bacterial meningitis is a rapidly progressive, life-threatening illness. It is diagnosed on the basis of the history, physical exam, and the results of the lumbar puncture. The lumbar puncture is done to obtain some of the fluid that is contained within the meninges. When meningitis is present, this fluid will be cloudy because of the presence of white blood cells and bacteria. Antibiotic therapy must be initiated as soon as possible. When treated promptly, the outlook for full recovery is quite good.